So when do you think it's going to change? Or is there the air of change happening?
Well, it's difficult with Candida, especially because it has many factors that produce it. It has many symptoms and many treatments, because you have to use a diet plus acidophilus, which is a yogurt bacteria, plus garlic to help kill the Candida, and maybe an antifungal medication. And in medicine, the scientific approach is one symptom, one diagnosis, and one treatment. So we're not going to be able to fit people into that box with this condition. So, you know, science is sort of throwing up their arms about this, and instead of, you know, opening their arms to people who are suffering, they're kind of closing off because they don't know what to do. As I said, you know, a paper to be rejected because it's controversial or anecdotal, it doesn't make sense to me, because as a clinician, I'm making an observation, which is where science begins. I have observed this in 2,000 people, and at this, still with that information behind me, I'm not going to be able to publish this until I prove it in some way, which will probably take millions of dollars and a big research project. And it's very difficult, as I said, with something so multifactorial and with so many treatments, to isolate one aspect of it and prove it.
That's a big job.
And it's the same thing with most of nutritional medicine. What medicine will say is that, well, it's not proven. Now, it doesn't mean that it's been disproven, but it's not proven. However, 80% of the treatments that we use in medicine, because I'm still a medical doctor, 80% are not proven.
Why are they then able to be used?
They've always been used, so therefore they are accepted. It does boggle the imagination. I mean, even there have been operations that have been shown to be unfavorable for people, yet they're still done. There are many interesting aspects of why natural medicine isn't accepted, and one of them being that I think it's too simple.
And it hasn't been proven. To their satisfaction.
Yeah, but it hasn't been disproven.
There you go. Well, at this point, we have a caller. Let's go to the phone. Hi, you're on the air. Do you have a question?
Yes, I do. My wife used to be a patient of Dr. Dean, and I tried to get in as a patient because I had this problem, and of course she said, So now's my opportunity. My wife and I, we were on holidays in the Dominican Republic, and I came back, and I wasn't feeling very well, and I used to smoke 2 packs of cigarettes a day, and I quit smoking right away because it was bothering me. And I was getting dehydrated, and I was getting lightheaded all the time. So I went to the doctors, and they did blood tests, and it came back. The only thing they could find that my liver was giving off enzymes. So I'll try to keep this short. So what happened anyways, they wanted to do a biopsy, and I said, I didn't want that to be done. So my wife put me on this diet, and I fasted for 2 days, and I went on a vegetable diet and everything else, and I started feeling a lot better. And what happened was I got my blood test back actually today, and my liver's fine. So I went through 3 months of going on this vegetable diet and everything else, but I'm still dehydrated. I'm still don't get enough. Like I drink tons and tons of water. So the doctor's on one hand saying I'm fine now. There's nothing wrong with me, but I feel 100 times better, but I'm still thirsty. Do you know why? Why that would be?
Oh boy!
Over the phone.
It's a very interesting story. But now I can't prescribe to you over the phone, and that you say I wasn't able to take you as a patient. And this is what I was saying to Anne. It is so unfortunate because there are so few doctors who are doing this type of medicine, and it's very hard for me to see everybody, and that's why I've written the book.
Exactly.
Now, what I'm wondering is, now, aside from you, let's just be general. If I thought of a person eating a lot of vegetables and then not retaining fluid, I would wonder about their protein levels, because if you, when you have enough protein in the body, it helps hold and bind liquid, and you don't lose as much liquid. That would be what would come to mind. Not that, I mean, I don't believe in a high protein diet or necessarily that everybody should be a vegetarian, but that's what comes to mind, that maybe through all the fasting and cleansing and the vegetarian diet, that maybe there isn't enough albumin or protein that can help hold the fluid in your body.
Right.
But
I know because when I went on the vegetable and I went on the vegetable broth and that, I mean, this was all the stuff that you had actually
Yes.
put my wife on several years before.
it's like a cleansing program because, again, to generalize, sometimes when people go on vacation, they don't take care of themselves. They're eating in hotels, maybe drinking, and maybe even getting Montezuma's revenge, and maybe picking up organisms that you're not used to, and then putting a strain on the liver. And certainly cleansing with a lot of vegetables and a lot of broth is very important. But then there is a point in time, especially I find with liver conditions. I have observed myself clinically that people who get hepatitis or liver problems and they're vegetarians, it seems it's difficult for them to heal their liver without adequate protein.
Mm-hmm. In the Dominican, I was sick for 2 days. I mean, I was throwing up and I had the runs
yeah.
and everything else.
Yeah.
And then when I got back, I let it go for a couple of months, and when I went in, they thought it was hepatitis, but it kept on coming up negative.
Right.
Well, I guess maybe you should look into the protein.
Right. Okay.
Okay, thank you very much.
Thank you.
Thank you.